obstructive sleep apnea modes of therapy. So 2 weeks ago, we did obstructive sleep apnea terminology. We basically went over exactly what obstructive sleep apnea is, what an apnea is, what a hypopnea is, and what your AHI is. Also, we did a mini video over O2 saturation. So this week we're doing modes of therapy, 3 common ways that obstructive sleep apnea is treated, and then the mini video will be over C-flex, EPR, just these kind of flex technologies to give you some more information on that. So let's start talking about some of the most common forms of the most common ways to treat obstructive sleep apnea. First thing that you see or what you hear about a lot is CPAP therapy. So CPAP stands for continuous positive airway pressure. It's a continuous flow of air that will enter the airway, normally through some type of interface on your that you're wearing, some type of mask. The second form that you see a lot of now is AutoPAP therapy. So this is also a CPAP, which sometimes can be confusing when people are first starting or first being introduced to their equipment. So an AutoPAP is actually a CPAP. It's not a bilevel. The third common form of therapy that you see is a bilevel. So what a bilevel does is it will give you one pressure or a certain pressure on inhalation and a lesser pressure on exhalation. I wanted to do modes of therapy a little bit different. So I want to introduce you to Boxy. Say hi to Boxy. Boxy is our imaginary sleep patient. So Boxy is someone that I see every day. He's going to be a male for this example, but it could be a woman. So Boxy is a guy who has been put on the couch or in the spare bedroom because his snoring is shaking the walls. So his wife has said, Boxy, if you don't go do something about that snoring, you will not get back in this room. So Boxy's been in for his sleep study, found out he wasn't just snoring, but Boxy has severe sleep apnea. So here's Boxy's results. Boxy has severe sleep apnea. His AHI, his apnea-hypopnea index, or how many times per hour he stops breathing, is 32. His low oxygen levels, 81%. His average oxygen level is 94. So Boxy is in that severe range that we talked about. Remember, anyone greater than 30 on their AHI scale is in severe range, and he has some significant drops in his oxygen level. So Boxy's gone back in. He's had his second sleep study, and he got tested with the CPAP. So here are the pressures that they tested Boxy on when he was there in the lab. His first CPAP pressure was 5. At a CPAP pressure of 5, his AHI was still 68, so it actually went up a little bit, and his oxygen level is at 83. At a CPAP pressure of 6, his AHI is now at 30, and his oxygen level is at 88. At a CPAP of 7, his AHI is 10, so he had a good drop there, and his oxygen levels are now 91. At a CPAP pressure of 8, his AHI is down to 2.3, so he's finally in the normal range. His oxygen level's at 94%, and they tested him for a CPAP pressure of 9 also. His AHI at that pressure is 0.8, and his oxygen level is at 91. So Boxy's doctor decided to set him up with a CPAP pressure of 8. Again, CPAP stands for continuous positive airway pressure. So the way a CPAP works is a CPAP machine is actually just a blower. It will pull in room air, pressurize that air, introduce it to the mask, and the mask itself will introduce that pressure to your airway. The pressure will sit in your airway like a stent, so when the tissues in your airway try to sag and cause an apnea or cause a hypopnea, that pressure that's sitting in the airway just holds everything in place. So with the CPAP, some of the features that you see, normally they all will have a heated humidifier. You don't have to use the heated humidifier, but it's there for patient comfort. It cuts back on dryness. People who are complaining of a sore throat or it's drying their nasal passages out a lot, a heated humidifier works really well to help with that. A CPAP machine, the pressures that it can be set on, 4 to 20. So the minimum pressure that you can set a CPAP on is 4. I saw a machine that went to 3.5, but the majority of them are 4, all the way up to 20. So remember, Boxy, we're setting his CPAP pressure of 8. A con of CPAP therapy is that it is a continuous force. So again, that pressure is blowing in even when you get ready to exhale. So it can be tough to breathe out against that force that's blowing in. Our example, Boxy, was set on a pressure of 8, which is a lower pressure. But for the patient that's sent home on a pressure of, say, 15, that can take some time to get used to. Some people do get used to it with consistent use over time. Some people will need a little help, which is why we put the video out about the EPR and the C-Flex. Let's look at an AutoPAP and how it's different from a CPAP. So remember, an AutoPAP machine is actually a CPAP machine. So you get one continuous pressure when you're on an AutoPAP. The difference in the two machines is that an AutoPAP has the technology to monitor if there are obstructions in the airway. So if it feels like you're having a hypopnea or an apnea, the AutoPAP machine will adjust its pressure. So let's use Boxy's example again. Let's change some of his results. So on his titration study, when he came into the sleep lab the second night, on a CPAP of 7, let's say that he was sleeping on his right side, and on a CPAP of 7, his AHI dropped down to 0.8 and his oxygen level was at 91%. During that time, he flips back over to his back, and let's say at a CPAP of 7 on his back, that number goes back to an AHI of 10 and an oxygen level of 91%. They bump his CPAP pressure to 8 and his AHI goes to 2.3 and the O2 level goes back to 94. And then they bump his pressure again to a pressure of 9 and he gets an AHI of 0.8 and an oxygen level of 91. So the only thing that's really different with Boxy this time is that at some point he flipped on his side and he did really well there at a CPAP of 7. There was really no need for a higher pressure until Boxy flipped back on his back, and then we start to see apneas and hypopneas again. So in that situation, an AutoPAP is really nice because an AutoPAP could be set from a CPAP of 7 to a CPAP of 10. The widest range that you can have for an AutoPAP machine is, again, CPAP of 4. I've seen 3.5, but the majority are 4, all the way up to a CPAP of 20. So in Boxy's situation, the technologist could set, or his therapist could set his CPAP pressure from 7 to 10, and his machine would have a range where it could adjust all night. Second scenario for Boxy using an AutoPAP machine. Say Boxy was sleeping just fine again on CPAP of 7 on his back. So we're going back to the original numbers with Boxy. He's on a CPAP of 7. His AHI is 10. His oxygen level is at 91. On a CPAP of 8, his AHI is 2.3. His oxygen levels are 94. And on a CPAP of 9, his AHI is 0.8, but his oxygen levels are at 91 now. So say Boxy is sleeping just fine that way for an hour and a half, and then he gets into this stage of sleep known as REM stage, which is a deeper stage of sleep. So one of the characteristics of REM stage sleep is that you lose more muscle tone. So as your body loses more muscle tone, your apnea or your chance for apneas and hypopneas will increase. So say Boxy's sleeping fine, he goes into REM stage sleep, and now at the CPAP pressure of 9, his AHI is 12 again, even though he's on the same pressure. The technologist bumps him to a CPAP pressure of 10, and that number comes down a little, but she still has to bump him again to a CPAP pressure of 11 to get him back into the normal ranges. Well, he would benefit from an auto PAP also, because an auto PAP would be able to be set, say, from a CPAP pressure of 7 up to a CPAP pressure of 11 or 12, and then you could cover that stretch. So when he didn't need so much pressure, when he wasn't in REM stage sleep, he could have his lower pressure. As he dropped into REM stage sleep and these apneas and hypopneas start to occur, or he starts to snore, the machine would adjust for that. So you would have someone who could sleep fine on the lower pressures at night and then get that higher level of pressure when it was needed. You wouldn't necessarily have to have that full pressure or that 12 or 13 all night. It's a lot. That's saying a lot. That's a lot of pros for an auto PAP, but there are reasons to not use an auto PAP. If you have not had a titration study, it's not always a good idea to go straight to an auto PAP. So I say that with caution, because I know there are a lot of places that do that now. The patient won't necessarily come back to sleep in the lab, but they'll go home after their first night with an auto machine. You don't want an auto machine set wide open. So you don't want really it to be a minimum of 4 and a maximum of 20, and then the patient just goes home with it. You want to put a leash on this machine and tell it, okay, this is a good pressure for the patient, and this is a good pressure for the patient. Oof. Auto PAP should have had its own video. It's nuts.
Wasn't a fancy car, wasn't a diamond ring, wasn't friends or lovers at the end of the day. Cause life's hard and it can bring trouble. In the midst of this trouble, no one can take it away. You need to stay